Christine Thompson, Cancer Prevention Programs Manager at Nevada Cancer Coalition. More people are diagnosed with skin cancer each year in the United States than all other cancers combined. In fact, 1 in every 5 of us will develop some type of skin cancer by the age of 70. Fortunately, most of these skin cancers are treatable and curable if found early. May is Skin Cancer Awareness and Prevention Month, and today we're talking with Dr. Whitney Hovenic. Dr. Hovenic is a board-certified dermatologist and one of only 4 fellowship-trained Mohs surgeons in Northern Nevada. She is founding member of and president of the Nevada Society for Dermatology and Dermatologic Surgery. Dr. Hovenic practices at the Skin Cancer and Dermatology Institute in Reno. Thank you for being with us today, Dr. Hovenic.
Thank you, Christine, for having me.
How are skin cancers treated?
We have many ways to treat skin cancers, Christine. That's sort of my passion. So it can be as simple as using a topical cream. There are some skin cancers that are amenable to using a prescribed cream for a certain duration of time. Other skin cancers need to be cut out, and that we do that with an excision, or we use a technique called Mohs surgery, which is commonly used for basal cells and squamous cells, which is a technique for removing skin cancers, especially in cosmetically sensitive places like the face, or even places you might not think about, like right on your shin, where it's very difficult to get a wound to close and there's not a lot of excess skin. And Mohs surgery is a technique where we're removing the cancer in the office, and we're also doing the pathology right there on the spot. So when you leave after your Mohs procedure, you know your cancer is gone, and we know that the cancer is gone before we do any kind of repair work to fix where the cancer was.
Do people need chemotherapy or immunotherapy if they've had surgery, that excision or a Mohs surgery, to treat their skin cancer?
Generally, no. Usually surgery is cure for, especially for early skin cancers, basal cells, squamous cells. The vast majority of them are cured by these other modalities, including surgery. Melanoma, however, if it has spread to distant spots, if it's in the lymph nodes or if it's spread to any other organs, will need a chemotherapy that's basically what you said. It's an immune therapy where we train the immune system to fight off the disease. And that's when you have a referral to an oncologist.
So what are the chances that skin cancers of any type will recur somewhere else on the body or spread if they're not caught early?
That's also a good question. Some of that depends on your own risk factors. The people who have the highest risk of having recurrence from skin cancers have other immune conditions. So especially our patients who have undergone organ transplants do have a higher risk of recurrence because they're on medications that suppress the immune system. Skin cancer is very responsive to the immune system. The immune system is kind of always geared up fighting DNA damage. And when that immune system is not in great shape, that's when people start to have problems, especially with skin cancer. But generally, for most types of skin cancer, we have after surgical excision, especially after Mohs excision, we have cure rates in the 95 to 100% rate.
Great to hear. So what does someone who has been treated for skin cancer need to do differently than other people?
We really advocate for our patients who have had skin cancer to make sure that they're doing self skin checks, which means looking at their own skin about once a month. Just get out of the shower, look around, can't see your back, have somebody else at home look and see if there's anything back there that looks suspicious. I oftentimes have people come in for their skin checks and their wife or husband has circled things that they see. So give your spouse a pen and let them point out things that look suspicious. And then it really comes down to protection, being very diligent about sunscreen use, sun protective clothing, and just getting your skin checked periodically. And the frequency of getting a skin check really differs depending on the type of skin cancers you've had. For people who've had melanoma, we see them really frequently. We'll see them every 3 months. If people have had multiple squamous cell carcinoma, we're seeing them more frequently. But if you've just had one skin cancer and you've seen a dermatologist for follow-up, then generally you're going to be seen on an annual basis for a skin check.